joining us on the program today is Danny Timblin, President and CEO of Onlife Health. Danny, good morning.
Hey, good morning, Doug. How you doing? I appreciate you having me on.
Yeah, great to have you on. Good to talk to you again.
I want to go to Vegas, by the way.
All right, come on out. We want you out there, by the way, okay? Danny, I got in studio with me Ron Bachman, my co-host here as well, and would like to kick off by you kind of giving our audience a little backgrounder on Onlife Health and your position in this space.
Yeah, absolutely. Ron, it's nice to meet you as well. I appreciate you guys spending time with me today. Onlife Health is one of the nation's leading wellness platforms, and at the heart of what we do is we replace bad habits with good habits, especially when it comes to lifestyle management. So we've been in the space for about 20 years. Our core markets, we sell to and through health plans direct to employers, and starting in 2016, we're going to be entering into the kind of a business-to-consumer arrangement on the exchanges. So we've got a lot of exciting stuff happening here out of Brentwood, Tennessee.
Yeah, you ought to join us at Private Exchange Forum and get in the discussion there too. But that's great and that's exciting. In your terms, define consumerism in healthcare. How do you define it?
That term has been out there for, 10, 15 years, and great question. At Onlife, we believe consumerism, as it relates to wellness, is about understanding the individual person and putting forward a set of services and technology at the right point in the individual's daily routine or daily life, so that they continue to press forward with good habits. In our 20 years of experience, we've learned a lot about how to anticipate, understand, and focus on our customers' needs and make those needs our first priority. I think if you look back about 10 years ago, consumerism was defined as merely a high-deductible health plan and maybe a health savings account. And we've seen that dramatically shift over the last decade, where it's gone from more of just another plan option to really understanding human behavior, what motivates individuals, and then arming them with the tools and the resources and the solutions to affect positive change, not only with how they carry out their life from day to day, but also from a medical claims perspective, lower emergency room admissions, greater productivity and presenteeism at work. So I think it's really evolved over the last 10 years.
Yeah. Danny, this is Ron Bachman. Talk about the technologies that you utilize. There's lots of things going out there with different, apps and wearables and gamification, those sorts of things. What are some of the technologies that you utilize, and what have been some of the most successful ones?
Oh, wow. Great question. In the last couple of years, I think we've all seen the proliferation of gadgets and apps and gamification and wearables. It's been all the rage. You couldn't say that 5-10 years ago. We've seen the evolution in the adoption of personal health technologies, and we think it's definitely advantageous to wellness. It brings an element of fun to wellness. I heard a term used about 2 months ago called edutainment. And that's really the ability to share what's being monitored, like, hey, I just ran 5 miles, or I just did this, which I think intrinsically motivates people, especially in a social context. And now we also have, through these gadgets and the technology and the wearables, verifiable data. So I think we've overcome some of the traditional limitations of self-reporting. We've seen smartphones. We have one out there like our Always On app, which helps employees engage with their wellness plan essentially anytime, anywhere, to improve their health, stay inspired, and help reduce healthcare costs. Interesting, just a quick story. We set up an activity program for one of our clients and simply focused on 5,000 steps a day, and we provided users with the wearables and the cash incentives and track their progress. And the outcome from that program that we established, we saw participants absolutely lower their claims costs, had fewer hospitalizations compared to the peer group who didn't participate.
Yeah, so it's not just gadgets or wowing people with new innovation. It's actually working, correct, Danny?
It is working. I think people, I think folks maybe underwhelmed if they just think that slapping a watch on their wrist is healthcare. We're taking the gadgets to a different level where it becomes being able to monitor and track performance behaviors, reward those behaviors and those performances, and that's where I think you start getting into more of a healthcare bent as opposed to just gadgetry.
Is there a danger of technology overload out there?
I think the world is full of technology. I don't know if it's overload.
Yeah.
I think the biggest risk or threat for us as it relates to healthcare is the concern that we see from individuals really around who has access to their personal health information. And we at OnLife, just like all the payers and all the other folks participating in this healthcare space, we go to great lengths to reinforce that protected health information, make sure that it's private, it's HIPAA compliant, and the employer doesn't have access to it. So maintaining the privacy and the confidentiality of that data, I think, is priority number one. But I don't see a downside to technology flooding the market, other than you got consumer choice, which is great, as long as we continue to maintain and protect the health information.
Well, Danny, for people listening in, what is your business model? Are you selling to strictly to groups, to large employers, to small employers, to individuals? Where's your market?
I don't want to, in answering that question, I don't want to come across as like the jack of all trades. Traditionally, the sweet spot has been with health plans and direct to large employers. And that's where, the ability to scale the business model, whether it's the high-touch nature of our traditional kind of platform, which is the coaching services and the direct one-on-one human interventions. And now that we're moving into more of a lower weight, high-tech technology services component, I think you can easily get to greater scale and be able to go after those markets that have traditionally been underserved, but with pent-up demand like the smaller employers, where you can make it economically advantageous on both sides and still carry out your mission of impacting people's lives for the better. And as I mentioned a couple of minutes ago, we're excited about entering into the federal exchange market at the beginning of 2016 because I think it's taking us into a market that most health care companies struggle with unless you're a doctor or a pharmacist, which is directly reaching out to the end consumer and working with them individually.
How do you find what some would call the enterprise solutions, working with large employers? Because that group activity and that group support that you talked about earlier, we know has been very helpful in the past in areas like weight loss or alcoholism or other issues where you have that sort of group support. So the enterprise solution kind of has a dimension that helps support that. Have you seen particular growth in one part of your business or the other as you reach out to new areas like the exchanges?
I think the growth is going to be in companies like OnLife being able to get into that small market. And if you think about it, there's only a handful of there's only 100 Fortune 100 companies or 500 Fortune 500 companies, and there's that pent-up demand for people in all organizations to have wellness, whether you are well or whether you're dealing with chronic illness. Wellness is nutrition, good exercise, healthy habits, stress management, tobacco cessation. Those are all key elements of maintaining a good lifestyle. I think what we're seeing a little bit from an enterprise solution perspective is if and this is where I think we're pretty good, is getting in and stratifying a population so that if I know Doug is incredibly healthy and I can understand what motivates him, I know he's probably inclined to deal with more of the self-directed or technology aspects of our services and capability set, as opposed to somebody that maybe on the metabolic side or very ripe for about to enter into a chronic condition, and they may require more of a higher touch component that we provide, where there's more interactions daily or weekly to be able to pull that person back to the right side of the healthy fence, if you will, and keep them out of help them avoid maybe a 10 or 15, 20 year period of high drug expense and going in and out of the delivery system. So I think it just depends on your state in life, and that's where our data analytics, I think, is top-notch in helping us stratify a population and then pick the aspects of our enterprise solution that meets their needs.
Yeah, Danny, we see a lot of activity, and I think you're validating that with your move to what I classify as that 100 to 5,000 employee life market. They need help, and they're embracing wellness probably more now than they have in the last 5 to 10 years. I think you're seeing that too, and kind of moving your solution to serve that size of company. So I couldn't agree with you more. Talk a little bit about ROI. I mean, there's a change in the way employers look at ROI. It's still very important that CFO could see an ROI, but there's a change in the way they look at that ROI. Give us your perspective and what you see with your clients from an ROI measurement and how they're looking to measure ROI.
That's a great question, Doug. I think 10 years ago, ROI, whether it was the wellness companies, the disease management companies, whether it was the industry in general, everybody is demanding or they want a definitive ROI. And as a former CFO, I can't blame them. They want to be able to assess the impact of wellness. And based on our 20 years of experience, we've helped organizations understand how and what to measure to understand if their program is working and progressing for them. We've also seen some disruption to that traditional ROI measurement where, in years past you would have a couple of actuaries getting in a room and fighting it out to figure out who can discredit one or the other. I think what we're now seeing at the plan level and from an employer perspective is a movement toward a concept called value of the investment or value in the wellness investment. In fact, OnLife has participated in a consortium of experts who got together and published recommendations on common measurements and metrics for evaluating the wellness programs. And the difference between the ROI and the VOI, VOI is a much broader framework with which to measure a program's overall performance. So it can factor in whatever elements are most important to a client, whether it's improving employee productivity and performance or employee satisfaction, health outcomes, retention, recruiting. Does my employer actually care about my well-being? And that's where I think that's going much broader beyond, the benefits are being quantified much broader than the traditional ROI calculation ever did, where it was just simply total program benefit maybe divided by the cost of the program.
Mm-hmm. Danny, as a recovering actuary myself, I know that getting the data together on these areas is something very difficult, and most employers don't really keep good data on unscheduled, absences or productivity measures that you might think they would have, and disability claims. All those sorts of things may be somewhere in their system, but they don't really necessarily have a good handle on all of that. So it gets down to, in some ways, I think, sort of paraphrase what you're saying, it's about an organization caring about their employees as opposed to just focusing on cost. And usually that comes down to CEO support. Is that what you've seen, and how do you assure when you're going into to an environment to make your sale that you've got strong top management support?
Well, I tell you, the culture of wellness and the willingness from the C-suite or the board is absolutely a key ingredient to success. I mean, wellness is an art and a science, and there's no magic bullet, if you will, but we do think there's a winning formula, and that starts with support from the top. In fact, we've walked away from opportunities in the marketplace because we knew that, whether it was the employer or OnLife being the strategic partner, we weren't going to be set up for success because the CEO or the CFO or the board simply wanted to put something out there to say, let's check the box. But you could tell that the fire, the energy, the passion behind it wasn't going to be there. But I absolutely think that from an employer perspective, having the C-suite as a true champion of the wellness objectives and strategy is fundamental to ultimate success all the way around the table.
Danny, listen, it's been a very good discussion and enjoyed it as always. I want to give you an opportunity to wrap this and leave our audience with a couple takeaways.
Well, I tell you, if maybe one of the takeaways is focusing perhaps on what's next for the wellness industry. We're in a sustainable trend growth market that is showing no signs of capitulation, and obviously it's a very crowded space. And I think what we'll see is we're going to see consolidations as well as more venture capital fueling startups and niche providers. But where it comes down to OnLife being relevant in the conversation, not only for the last 20 years but for the next 20 years, is we're going to continue to be at the center of the strategy for plans, employers, and engaging their members, patients, and the consumers with personalized, relevant, and effective pathways to health. And we're excited about where we sit in this space and the fact that we're a key part of the change in the healthcare conversation for our country. It's exciting times, and like I said, I appreciate you guys spending time with me today.
Yeah, thank you, Danny, very much, and enjoy the weekend, and we'll talk to you real soon.
Take care.